Hello, and welcome to the January Superintendent Update, our chance to talk with Superintendent of Schools, Eric Conti, about all the latest school news. Eric, thanks for taking some time and joining us once again.
Of course, Rich.
So I guess, we have to talk about the big news being COVID, or the Omicron variant. The last couple of weeks since, we've got back from the vacation, what have we seen as far as numbers?
We've seen a huge spike in numbers, just like the state has seen, just like the town has seen. I think the new variant is much more contagious than the prior variants. Fortunate for all of us, it seems to be less virulent, so more positive cases, but hopefully not as many people sick.
Yeah, having it real severe.
So I'm saying I think that seems to be how the disease is progressing. So that's what we came back to. So it's, we were hoping we were going to be done. We were dealing on this on individual, sort of on a case-by-case basis, largely for the last couple of years. And all the mitigation factors we have in place had to be sort of rethought. Some of them don't fit this situation particularly well. And we're hoping the agencies that sort of create the guidelines and protocols will update those because of the different context that we're in now.
Right. And also maybe have some more agreement between each other.
Yes.
It would be nice. So you mentioned, some of the protocols had to change. I think, that was a big discussion at Tuesday night's school committee meeting. Just talk about, the changes to how you're approaching the test and stay program.
Well, the concern with the test and stay as it was that we were bringing students who were shedding virus back into school too soon.
Right.
So they were identified as a close contact, and that has a whole meaning, a separate definition. And they were returning to school the next day. They were testing negative on a rapid test and then going back to class, but still possibly shedding virus and spreading the virus.
Right.
So what we were told is that it takes some students, some children, 3 to 5 days to get enough virus to trigger a positive test if they are truly positive. So I think one of the changes we made with test and stay is we're just putting a 5-day delay before the test and stay program starts. So for students in quarantine, again, if you're a close contact, you go in quarantine. If you're a positive, you go into isolation.
Right.
But if you're identified as a close contact, then you would be out for 5 days, and then you can test on day 6. And then with a negative test, then go back to go back to school with strict masking is how we're saying.
Right.
How we're saying that.
And strict masking is not just for the close contacts now, because the state has also extended the mask mandate to the end of February, correct?
That's correct. So there's, again, a state-required mask mandate in schools. And so we are obviously implementing that as best we can.
And as far as close contacts goes, my understanding is if you're fully vaccinated, then you are not considered a close contact.
That is correct, except there are 2 current definitions of fully vaccinated. So that's,
yes.
Again, that's still part of the confusion. So we are using the Department of Ed definition, which does not require a booster at this time. My belief, though, is at some point in the near future, the Department of Ed is going to change their definition of fully vaccinated to match the CDC, which does include the booster vaccine. So right now, again, for our students, it's 2 shots.
Okay.
Or one of the Johnson & Johnson vaccine. So those would be fully vaccinated who aren't considered close contacts. Also, if a student has had COVID and recovered from COVID in the last 90 days, they're not considered a close contact either. So unvaccinated students, again, if they've had COVID and recovered from COVID in the last 90 days, really look the same from the CDC's perspective as a vaccinated student.
Right. And last thing on this particular part is just the definition of close contact has been changed. It used to be 6 feet, now it's 3. Talk about that change.
Right. There was the way that the Department of Education wanted schools to operate was at 3. Part of the confusion was that the CDC wanted us to contact trace at 6.
Right.
So we were setting up schools differently, and by doing so, we were over-identifying close contacts because we're having students sit at 3 feet and then we're contact tracing at 6. So what we're trying to do is, what we are doing is now contact tracing at 3 feet, so we should be identifying fewer close contacts. And again, there's one of two thoughts on this, given how quickly the virus is spreading. We're either all close contacts
Right.
or none of us are close contacts. So we're sort of stuck, as I said. The regulations really haven't adjusted to our current context. We're trying to do the best that we can to implement what we are required to implement, but do it in a way that keeps as many kids in school as possible safely and allows us to sustain the practice, because there is no way that our nursing staff could have continued close contacting at 6 feet given the number of cases that we currently have.
Right, I know. I remember all the work that was being done at Francis Wyman before the break when it was just that one school, and now it's, obviously the whole district. So, and I think it was our health director, Susan Luminello, who just said, just consider everybody close contact at this point.
Right, but again, just saying that and having the school district do that, we're still bound by the agencies
Right.
that control all of us, so public entities. So we are sticking with the CDC guidelines, and when possible, if the Department of Education has a slightly different standard or a lower standard that allows kids to come into school, we're using the Department of Education standards. We just can't make up our own.
Right, that does make sense. Now, part of this is, once someone is identified as close contact, you want them to get, obviously a test. And I know that you had talked about trying to get tests to, supply to students' families and hopefully staff if possible. But it's a little pricey. So it was like what? The minimum order was 1 pallet when it was like 9,000 something tests?
Yeah. So it was like $85,000 for the pallet off the state bid list. I think we're waiting on that just because we're hearing that we should be receiving tests from the state relatively soon. And I'm hoping that there's follow through on that. In the next week or two, we'll get tests in. I think at this point, what it would cost for the community and the time that it would take to have them all delivered may be fairly close to when we could get our test from the state.
Right.
If it was going to be 4 or 5 months difference, then I think I would think about it a little bit differently. But I'm thinking we can put off the purchase and just get the tests as the state provides them.
Oh, okay. Excellent. And I guess switching gears now, we have a town meeting coming up, and there's not a lot from the schools on town meeting this time. Thank you for helping keeping the meeting short.
Okay.
But you do have 2 feasibility studies for Fox Hill School, one with state assistance and one without. Just talk about, those warrant articles.
They're both really the same warrant article, just using different language, and one actually may be withdrawn. We're getting a legal opinion now as to whether the one warrant is sufficient to cover both directions the school committee may choose. So the warrant article is really the first steps in moving forward the Fox Hill building project. And again, one path the school committee could decide on is to work with the Massachusetts School Building Authority, and that is the state's agency that helps support the construction of school buildings. We've worked with the MSBA both on the Memorial School project and the Marshall Simons Middle School renovation and addition. The other pathway could be the school committee may decide that the restrictions of the MSBA grant program may not support their vision of what elementary education needs to be in Burlington. In which case, again, we still need a new Fox Hill school.
Right.
They may ask town meeting to forego the Massachusetts School Building Authority grant and to look at local funding completely for a new Fox Hill school.
Right, because the MSBA has like restriction or limits on like class sizes and things like that that are sticking points, right?
Not limits on class sizes. I think their class size models are higher than we currently have in the district.
Okay. Oh, okay.
And their enrollment projections, which we have to use, project that we'll need 3 elementary schools, not 4 elementary schools. So if we work with MSBA, they would require that we shut down one of our elementary. Pine Glen would be the school that we would have to
Right.
shut down. And then we would have to redistribute those students across the 3 elementary schools. So Francis Wyman would sort of gain 130 students. Memorial would gain a significant number of students, and then Fox Hill would carry the new Fox Hill would carry the balance. So again, it's a completely different vision for elementary education than currently exists. I don't believe, the school committee currently doesn't support that. They've
Right.
supported a 4 school at the elementary level for Burlington. They would need to change their current position if we were to move forward with the Massachusetts School Building Authority. So,
Gotcha.
so again, I think that we're going to be discussing that next week, and then presenting their decision to town meeting.
All right. Yes, and I also remember there was quite a bit of pushback from the community when that was first like put out, even as just an idea. So
As a consolidation, losing one of our elementary schools,
Yeah.
parents certainly didn't want to lose an elementary school.
And last thing, not to get into any, there was some, heated exchanges at the school committee meeting, but just in general, your sense of how the contract with the teachers is progressing.
Again, I have a slightly different perspective. I think because I'm sitting in all the meetings and I'm there, so I think that the negotiations have been respectful. I think the negotiations have been productive. I think it's takes a long time, but you have to remember we inserted 2 agreements on the working conditions during a pandemic. So we had to do that for 2 school years in a row. Those negotiations were inserted in the middle of a larger contract negotiation, so it's just taken more time. I do think everyone is working hard. I do think there's people are heightened because of the situation that we're in terms of the pandemic, and I think we saw some of that emotion come out. Again, the emotion is understood. But I've witnessed nothing but respectful dialogue, both from the negotiating team, from the teachers union, and from the school committee members who are bargaining with them.
Excellent. All right. Everyone can get along. That'd be good. All right. Well, thank you very much. We'll definitely have you back next month. Hopefully the situation with COVID will be a little bit, less stressful than it is right now.
And again, there's an upcoming vaccine clinic at Burlington High School from 2 to 8. I'm trying to remember the date from the week in review. Was it the 24th, I think, maybe coming up? So if you could promote that and
Sure.
make sure that that's, I got the date correct. I might not have gotten the date correct. So
We'll check it. We'll put it on our social media.
you could do that. And I do think the next 2 weeks will be difficult in terms of cases, but it seems like they're predicting the caseload will drop significantly at the end of January. And that's what we're hoping, both with the mitigation factors we have in place and with just how this variant seems to be, the pattern of this variant as other people have experienced, other places have experienced
Right.
it. So again, I'm hoping that we'll see many fewer cases as we get to the end of winter, and then into spring we can try to get this all behind us.
Deja vu. I think we were saying that last year. On
Yes,
this.
but again, I'm the eternal optimist.
There you go. Good. I'm glad. All right. Well, thank you again.
All right, take care.
You too.